So if you're struggling with an ache or a pain in your hand, your fingers, or even your forearm, or perhaps you experience a tingling sensation in your hand, fingers, or your forearm, or you have some numbness in the area, or what about maybe you've lost some grip, some strength, especially with your thumb. Well, if you have these symptoms, you might be struggling with a carpal tunnel syndrome. Now, what I'm going to do in this video is I'm going to demonstrate 2 tests to you can do at home to determine if the symptoms you're feeling in your hand and your forearm are actually caused by carpal tunnel syndrome. Then I'm going to give you some tips on how to reduce the pain immediately. And lastly, I'm going to give you exercises which will help you with the carpal tunnel syndrome now and help to prevent it in the future. Okay, let's get started. So carpal tunnel syndrome is really common when you're pregnant, when you're holding on to your fluids, and those fluids can increase the pressure on some nerves in your wrist and give you the symptom in your hand. When you're diabetic or when you have arthritis. It's also quite common when you are doing a job, which means you have to flex your wrists an awful lot, move them an awful lot, or we have to do a lot of gripping. For example, when you're operating a vibrating tool, or when you're playing an instrument. And lastly, if you had an injury to your wrist or you've broken your wrist in the past, that will also make you more susceptible to carpal tunnel syndrome. So the 2 tests we're going to do are the Phalen's test and the reverse Phalen's test. And what we're going to try and do with these tests, we're going to put your hands in a certain position and thereby compressing the nerve in the carpal tunnel, and that should reproduce your pain. So we're looking for a reproduction of those symptoms. So the pain, the tingling, the numbness in your hand, maybe the loss of strength, grip strength. It could be in your hand, could be in your forearm as well. So the first test we need to do is called the Phalen's test. What you need to do is place the back of your hands together, push as much as you can, keep your shoulder nice down and relaxed, don't shrug your shoulders, push your elbows as far down as you can to get maximum flexion in your wrist, and you need to hold this now for 30 to 60 seconds. Now after 20 to 30 seconds, you should start feeling some symptoms in your hand if you have carpal tunnel syndrome, and that means this test is positive. So a positive test means it reproduces your symptom. So this is the Phalen's test. Hold this for 30 to 60 seconds, and after 20 seconds, 20 to 30 seconds, you should feel your symptoms. Now, a better test is called the reverse Phalen's test. And what you do for this test is you place your hand palms together, and then you lift your elbows up in the air as far as you can, but always make sure that the palms of your hand keep in contact. So keep them up, and we're doing the same thing now. We're trying to stretch the nerve, compress the nerve in the carpal tunnel. So you hold this now for about 30 to 60 seconds. But with this test, you should feel those symptoms that you're struggling with after about 10 to 20 seconds. So it's a bit more of a clinical relevant test for us, a superior test compared to the Phalen's test. So you hold this again for 30 to 60 seconds, make sure your shoulders are nice and down, and you push your elbows up, push your wrist down as far as you can. Don't let your hands come away from each other. Really make sure you push them together, and you hold this. Now, and again, if this reproduces your symptoms, so your pain, your numbness, your tingling, or the lack of strength you're having in your grip, then that's a positive test, and it means that you're struggling from a carpal tunnel syndrome. And now, next I'm going to demonstrate some pain relief for you and some exercises which will help with the carpal tunnel syndrome. So there are 3 things we can do for pain reduction. The first thing we can do is wear a splint or put some tape on your wrist like I've done here. So wearing a splint, especially at night, or some tape, what you do is you reduce the mobility of the wrist. And by reducing the mobility of the wrist, you're creating some rest. And as you know, we all need rest to heal. So I've put some tape on. See what it does, this tape, is it reduces mobility of my wrist to about 50%. So the wrist actually gets a bit of a rest and can start to heal. You can buy these splints online. They're about £10. I'd recommend you get a splint that only goes around the wrist and the thumb. Don't get those big ones that go all the way in your forearm. I mean, they're unnecessary, to be quite honest. You just want to reduce and limit the mobility of the wrist a little bit. So get yourself these simple splints. The second thing you can do is you use ice. Again, I've got an ice pack here. Have an ice pack, wrap it up in a tea towel, and just wrap it around your wrist like that, and then you hold this for about 10 minutes per hour. Don't do it longer than that. It's quite you've got quite a thin skin in your wrist, so you don't want to do it for too long in case you get frostbite, obviously. Make sure you apply a bit of cloth between the ice pack and your skin. You either have a t-shirt covering it, a long sleeve t-shirt, or you have a tea towel covering the ice pack. So you're holding this for about 10 minutes. And again, ice, it reduces the swelling, it reduces the inflammation, and thereby reduces the pressure on the median nerve and reducing the symptoms in your wrist. And lastly, what you can do for immediate pain reduction is try to reduce the activities that might cause the pain. So I mentioned before that repetitive wrist movement might give you the problem, for example, work or playing an instrument or using vibrating tools. So either you wear the splint at work using a vibrating tool, or you reduce doing that kind of work for a short period of time, again to give your wrist a bit of an opportunity and chance to heal. So those are the 3 things you can do for immediate pain reduction. Let's move on to some exercises for your wrist as well. So there are 3 types of exercises we need to do which will help you with your carpal tunnel syndrome. The first exercise we need to do is called neural flossing, and what we do is we try to pull the nerve through the carpal tunnel, thereby reducing the pressure on the nerve and reducing the symptoms in your hand. We also need to stretch the muscles of your forearm, and lastly what we need to do is we need to strengthen the muscles surrounding the wrist. So the first exercise we're going to do is a spinal stretch, and what we do is we're going to floss the nerve through the carpal tunnel here. So start off like this. Place your tips of your fingers together like so. Yeah, and then elbows need to come up. So fingers now pointing upwards. Then what you do is you turn your hands around so your fingers are pointing downwards. My fingers are still spread out, and all we do now is we go from putting our fingers together like this and straightening out our fingers. Make sure we stretch them at the same time and make sure our hand palms touch at the bottom. So we stretch out the fingers, hand palms are stretching, and we're keeping our elbows nice and down, and we're keeping our shoulders relaxed as well. So this is called the spider stretch. So you do this for about 10 to 15 repetitions and do about 3 sets. So a spider stretch would really help to pull that nerve through the carpal tunnel. So that's the first exercise you need to do daily. As I said, 15 repetitions, do about 3 sets, and you can do this throughout the day, to be quite honest. So that's the first neural stretch that we're doing. The second neural stretch we're doing is as follows. What you need to do is now place your arm on the side, 90-degree angle here with my hand palm facing forward. Then I'm pulling my arm 30 degrees backwards. Then what I'm doing now is I'm tilting my hand backwards, so the back of my hand is now going towards my forearm. Then I'm dropping my arm down to about 30 degrees angle with my body, and I'll tilt my left ear to my left shoulder, like such. And this is a stretch for the nerve that runs from your neck to the tip of your fingers. Now we're stretching out the nerve. And now what we can do is we can straighten or floss these nerves using different bits of our body. We can use our head to come back to the middle again and tilt our left ear to the side. That will floss the nerve. Or what you can do is bend and straighten the elbow. So bend and straighten the elbow to floss the nerve. Or what you can do in this position is keep your head and your elbow in the same position and then bend and stretch your wrist. Yeah, and the same thing here, you do about 15 repetitions and you repeat this about 3 times, and this will help to move and pull that nerve through the carpal tunnel and thereby reducing the symptoms that you're feeling in your hands. So the second thing we need to do is we need to stretch the muscles in your forearm. I'll show you 2 variants for this. The easiest one is this one here, where you straighten your elbow, make sure your fingers point down. What you do is with your other hand, you grab the tip of your fingers and you pull your hand back as far as you can. You should feel that in your forearm. And again, you hold this for about 10 to 15 seconds and repeat 3 times. A very easy one, which one something you can do throughout the day to stretch the muscles in your forearm. Please make sure you don't shrug your shoulders too much. Keep your shoulders nice and relaxed and down. So that's one you can do, but even a better one would be this one. You use the back of a chair or you could use a table. And what you need to do is make sure that your fingertips are on the edge. So your fingertips should be on the back of the chair. Keep your elbows straight, fingertips on the back of the chair, elbows straight. And then what you do is you walk back a bit and you really push your elbows forward. And this is an absolutely brilliant stretch for the muscles in your forearm. It's better than the one I've shown you before. A really good stretch. I can really feel this on this area there. I can really feel the stretch in these muscles here. So make sure the tip of your fingers are going to the back of the chair. And then you straighten your elbows. You walk back a bit, really straighten those elbows. Get into that stretch. Hold this again for 10 to 15 seconds. Repeat about 3 times. You can do this every day or multiple times a day even. And a fantastic exercise to stretch the muscles in your forearm. Now we've reached the last step in our 3-step plan to help you with your carpal tunnel syndrome, and we now need to start strengthening the muscles around the wrists and your forearms. So before we do this, it's a good idea to just loosen up your wrists, so interlink your fingers and just loosen up your wrists a little bit like this, so it's loose before you actually start doing these exercises. Only do it for about 30 seconds to a minute or so. And the first exercise we're going to do, super simple, is we're going to roll up a towel. So imagine you're trying to get water out of this towel, and what you do is you turn this towel as much as you can, and if you can't rotate this any further, that's where you're going to hold this for about 10 to 15 seconds. 30 if you can, but try 10 to 15 to start off with, and hold this 10 to 15, repeat this 3 to 5 times. You're going to feel this in your forearms, you're going to feel this in your wrists, so hold it there. So we've rotated this one way. Yeah, so after done one way, also make sure that we do the other way as well. So now the other way around. So there's already 2 exercises in one with one towel. And again, as far as you can rotate and twist this, and you hold this again for 10 to 15 seconds. Don't shrug your shoulders too much, keep nice and relaxed, and rotate and twist this for 10 to 15 seconds and repeat 3 to 5 times. These exercises are something you can do every day. So all you need for this one is a towel. And some other exercises you can do is you can use a TheraBand. I mean, they're very, very useful indeed. So we've got a TheraBand here. The first movement we're going to do is we're going to rotate our forearm from outside to in. That's what we need to do. So as you can see, I've got my elbow nicely tucked in to my side. My thumb is facing outward, shoulders nice and relaxed. And all we do now is we rotate our forearm in. Again, 10 to 15 repetitions, do 3 sets. Again, you can do this daily. So just rotate in. Now, normally I should turn around, face the wall. If I want to use the same arm, I'm going to demonstrate this now with my left side. So I've done thumb out to in. And now obviously what I need to do, it's not rocket science, is it? Is thumb in to out. So again, my elbow should be nicely tucked into my side, shoulders nice and relaxed. And we're now going to rotate my thumb from in to out. Again, I should normally face the other way. I just want to demonstrate this to you. Yeah? An easy exercise. Then the other exercise we need to do is just with the wrist. We're now going to move the wrist to the outside. Yeah? So with no movement in the forearm, just movement with the wrist. Again, I'm going to demonstrate this on the left side, obviously for camera purposes. So again, elbow nicely fixated in the side, thumb facing in, and all we do now is I move the wrist out and in. Same thing, 10 to 15 repetitions, 3 sets. Always ensure that my elbow is nicely tucked into my side. Yeah, and obviously what we need to do is we need to do this movement. Yeah? So when we move the hand inwards, so let me demonstrate it to you on my right side. Thumb is now facing inwards, and all I do now, again, same thing, elbow always tucked into your side, and you're coming in, and you're coming into the side, and you repeat this again 10 to 15 times, 3 sets. Great exercise for the wrist and the forearm. And the last one we're going to do is we need to strengthen the muscles that do this to your hand. So with the TheraBand, I'm coming outside over where my watch is, then I'm rotating and turning over my thumb, and then the TheraBand sits between my second and third knuckles, you can see. Yeah, second, third knuckle. Then I'm sitting upright, make a fist, and all I do now is I move my wrist upwards and down. And if the TheraBand sits between the second or the third and the fourth knuckle, what it means is you get a nice pull in the middle of your arm. You've got to be careful that the TheraBand doesn't sit too much over your little finger, over your thumb, and then the pull is obviously a bit asymmetric, which is something we don't want. So we do this again, 10 to 15 repetitions, and repeat this about 3 times. So those are really simple exercises to do to strengthen the muscles in your forearm and to help you with your carpal tunnel syndrome. I hope you've enjoyed this video. I hope there was a lot of value in this video for you. If you know someone who's struggling with carpal tunnel syndrome, don't hesitate and forward this video to them as well. If you want to leave me a comment or give me a thumbs up or subscribe to my channel, please do. For now, I'd like to say take care of yourself, take care of someone else please as well if you can, and bye for now. Bye bye.